I just sent it to you.
I have it
Okay, perfect.
because it's in the text you sent to me.
Yeah. And the way I structured it is to end with talking about Florida blues. All right. Thank you very much for joining us today. Today is June 1st, 2024, which is the beginning of Men's Health Month. And today we are bringing to you live the Fully Alive Men's Health Summit. And people often ask me, why do you focus on men's health? As a provider that sits in the front line of medicine, I've seen so many men in the hospital diagnosed with conditions that are easily preventable. However, by the time the condition is identified, most of the time, there is a point of no return. Some might get lucky where the diagnosis has a cure, and some, there are no cure. So this concerns me, just seeing men being diagnosed with diseases that are preventable and dying from them. That is why we chose this month to highlight and celebrate men's health, specifically men's health. And for the first series of the event that will be happening over the month of June, we'll be focusing today on the state of Black men's health. So this is supposed to be interactive, and there will be question and answers. And the goal is to provide information that will help you navigate the healthcare system to make you become fully alive, and which is the purpose of the Fully Alive Men's Health Summit.
So Dr. Adewale, talk to people about what fully alive actually means. So it's a concept that people are not familiar with. So when you say fully alive, what do you want people to feel like when they're fully alive? What do you want their lives to be envisioned for?
So when we talk about fully alive, I look at my life and I look at my journey. I'm an emergency medicine physician, and during COVID, as a frontline provider, I went through my own trials and tribulation, suffering in silence, and basically lost hope in the field of medicine and most of the things that I've been doing by virtue of being tired, fatigued, and almost burnt out. And I realized that the state that I was at the time is not tenable, and also it's not good for my family. So I had to rediscover myself. As I embarked on my journey to discover myself, then I embarked upon this story and research that led me to coining the word fully alive. And what does it entail? Fully alive means to be fully whole in all aspects of the dimensions of health, which is physical health, emotional health, mental health, social health, and of course, the anchor that puts everything together is the spiritual health. So to be fully alive means to be whole in all these dimensions of health. And that is why we want to make men be part of this Fully Alive Men's Health Symposium, because the goal is to make you fully alive, like I became fully alive, take control of my life, and become whole again.
Talk to the viewers about your 5 Pillars book.
Oh, yeah. Oh, as I embark on my journey over the past years, actually, my research led me to writing a book that was published 2 years ago titled Fully Alive, Experiencing the 5 Pillars of Wholeness. And what are these 5 pillars of wholeness? These are the pillars I utilize to embark on my own journey to become fully alive again. And the first pillar is physical well-being or physical wholeness. What does this entail? It's about taking care of your own health, taking possession of your own health, and being proactive, taking care of yourself, making sure that all the preventive stuff that has to be done to keep you healthy are done in a timely manner, making sure you engage in physical activities. Those are the things that keep your heart pumping, and at the same time, making sure you make time for yourself to rest. Because we spend so much time going and going and going and going, but we never take the chance to stop and rest. So as it relates to your physical health, those are the part of the physical health that actually makes you whole. Because one, you need your body, you need your physical health to do a lot of things. However, illnesses, diseases can affect your physical health and prevent you from being fully alive. The second dimension is emotional well-being or emotional health. What happens is, as we go through our days, we go through several emotions, ups and downs on a daily basis in a cyclical format. However, how you handle your emotion also determine how you interact with people around you. So for me, I had to learn how to manage my emotion. I had to develop what they call emotional intelligence and emotional quotient. And these are the things I've utilized over the past couple of years that's enabled me to adequately become whole in the aspect of emotional wellness. The next part of it is mental wholeness or mental well-being. Most men suffer in silence as it relates to mental health, especially Black men. And the reason why Black men suffer in silence is we do not have trust in the healthcare system. Most of the psychiatrists of Black men will see are not of your race. And by virtue of cultural differences and experiences, Black men are unwilling to seek help because the person you may be seeing may not be able to relate to you. So we end up suffering in silence. I never got to this point because I sought help before I got to this point. So it's imperative for us as men to not suffer in silence, to realize that taking care of our mental health does not mean we have a disease. It's about just knowing like we are balanced in how we deal with life stressors. That's the most important part of it. How do you handle life stressors? Do you handle life stressors by doing things that are not benefiting your body? Or do you do things that make you whole? So it's imperative for us as men to remove that stigma that's attached to mental health. There are negative part of mental health, there are positive part of mental health. The negative part of mental health might require diagnosis by psychiatrists and require medication. However, there are positive part of it, such as seeking counseling and guidance and coaching, because we all struggle with every aspect of our lives. And having coaching, having mentorship, those are the things that help us structure our life to have a balanced mental health. So please seek help if you're struggling in silence. And I'll give you an analogy here. If you know the pressure cooker, when the pressure rises in the cooker, there's a release valve and it releases the pressure. Men, we are like that. Unfortunately, we do not release this pressure. How do we release this pressure? Is talking about it, getting out of our chest. But most of us do not do that. So seek a way to release that pressure today by seeking counseling, guidance, mentorship to help you navigate these waters. Then the next aspect of the whole fully alive well-being 5-pillar concept is your social well-being. By nature, we want to be social. However, by what we deal with on a daily basis, we're isolated. Most men are isolated. And the reason why is this: we want to work hard and provide for the family. And we only circulate around us just our family. You go to work, you come home, you sleep, interact with your family, and that's it. But we're not doing anything on the outside. We're not part of the community. So to become socially engaged means you have to be part of the community. Go outside, interact with other people. You may find people that have similarities and common grounds with you. You have to have a social engagement because socially, what you give is what you get. And the more you interact with people, you find people with like-mindedness. Fills your cup, fills your bucket. By you volunteering in the community, giving back to the community, fills your bucket and fills your social bucket. By doing this, you're healing yourself from the inside and becoming socially well. And the anchor that puts these 5 pillars in perspective is the spiritual well-being. You do not have to be a Christian, Muslim, or Hindu to believe in spirituality. It's about knowing there's a higher being than yourself. That is the anchor that pulls the 5 pillars together. Because without spirituality, the other pillars does not exist. So you have to be whole. And there are several ways to accomplish state of spirituality. For Christianities, they go to church. They fellowship with others. For Muslims, they go to the mosque. For the Hindus, they go to the temple. So there are several ways. You could be an atheist and still be spiritual. You're just being connected to something bigger than yourself. So those are my 5 pillars that I've used over the years that allow me to become fully alive and whole again.
I love it. So when you came to me, this was probably 2 months ago?
Yes.
With this magnanimous idea of putting on a men's health summit for the entire month of June. I initially thought you were crazy.
Yeah.
And I didn't know that we could pull it off.
Yeah.
Through collaborative efforts, through the sponsorship of Florida Blue. Thank you so much, Florida Blue. We have been able to put it together. But why was it important to you? Because I jumped on because of your passion. So because you were so determined to make sure that we were discussing Black men's health and men's health in general, what was the true passion behind doing this? How long have you wanted to do something like this?
Well, I would just say this could not have happened without you and your team. And I do not know how you were able to pull this together in a span of 5 weeks.
Yeah, it's been fun.
But but we did it.
Your gray hair, my gray hair.
But we did it. And for me, from my vantage point as an emergency medicine physician, for over 2 decades, I've seen men suffer, men diagnosed with conditions that are preventable. And I've seen Black men in particular, die young from diseases that we have cure for. And this concerns me. I'm just sick and tired of not having our daughters, our sons, not having their father around because they died young. Not from homicide or violence, but dying from diseases that are preventable.
Right, because they're not going to get checked out.
Exactly. And that was my concern. And that was the impetus behind this. And the goal is to make sure that how do we educate our Black men to take care of their health? How do we make sure our Black men live longer to be able to be fathers, to be able to be wife husbands, to be able to be providers, and to be able to contribute to the community? Because it doesn't serve anybody well if you die young. The daughters, the sons, they need us. And if we die from something that's not has to do with our health, it's okay. Sometimes it's unexpected. But in this age, it does not make any sense for a Black man watching this to die from diseases that are preventable. And that was the drive behind this for me.
Yeah, we talked about how do we put this together and what would be some of our focal points. And what we came up with was we were going to share statistics.
Yes.
Then we were going to share solutions.
Yes.
And most importantly, we were going to share stories.
Yes.
Because people's stories resonate with other people.
Exactly.
When they feel that connection to the individual who is experiencing things that they did. I personally have male friends, who ignored symptoms for long periods of time and then found out that they had cancer, prostate cancer.
Yeah.
And fortunately, they lived to tell their story.
Exactly.
But a lot of men don't.
Yes.
Because even at that worst moment, they're still not going to get checked out.
Exactly.
Why are they waiting to go to the emergency room to get checked out? What are the myths versus the facts that we can kind of dispel?
Yeah. So specifically, most men do not like to go to doctors, period. They, make excuses to time and I'm too busy and stuff like that.
Mm-hmm.
However, when you look at the big picture, and when I say big picture, I look at it in the context of the life expectancy. And when we talk about life expectancy, we're talking about life expectancy as it relates to your year of birth. And what we're beginning to see is that from the data provided by the CDC and other scientific bodies, Black men die much younger than any other race.
What's the age difference or the differential?
So I'll put it in. So let's throw data out there.
Yeah.
Okay. So if a Black man is born in the 1950 to 1960s, the average life expectancy is 61 years of age. For a white man, it's about 68. For a Black woman, it's about 70.
So we have a lot of Black women that are living without their husbands because
Exactly.
they didn't go get checked out, which is why we want the women watching us and participating in this month-long summit, because we need you to be advocates for the men in your lives to make sure that they're going to get checked out.
Exactly.
So that you don't have that 9-year gap
Exactly.
of being a widow.
Exactly. For men born in the 1970s, the average life expectancy is 64 years old for a Black man.
So
If you're born in 1980, your life expectancy is about 66 years old. If you're born in the 1990s, it's about 67 years old.
So we've gotten a little better.
That's where we're heading.
Right.
And so what happened is, based on the year of birth, we start seeing this life expectancy. If you're born in the year 2010, actually your life expectancy is about 71 years old. So we've seen changes in there. However, the gap has not narrowed between a black man, a white woman, a white man, and a black woman. The gap is not narrowing, although we've seen increment based on year of birth. But if you imagine, a lot of the men watching this right now are probably born between the 1950s, 60s, and 70s. And knowing that your life expectancy is about 66 years old, it's scary.
It is.
However, if you were born within those ages, time span, if you make it to 65 years old, if you were born in the 1950s, you probably have about 13 more years to live. In the 1970s, you have about 15 more years if you make it to 65. So that means if you make it to 65, if you're born in 1970, you may live to be 79, 80 years old. But it's about making it to 65.
Right.
Because most of us will die before then. But if we make it past 65, our life expectancy almost equal a white man.
Okay.
And you start seeing the gap narrows. But regardless of that, a black women are still living longer, at least by 9 years, than black men.
There's no doubt the women in my life, when we feel something is wrong with our body, we go get it checked out.
Yeah.
We don't wait. And
No.
that's the problem is men are waiting. They're
Yes.
waiting 6 months. They're waiting a year to go get checked out versus the women who are saying, I know my body. This isn't right. I need to go to a medical expert and get it checked out.
Exactly. So one of the reasons why men don't like to go to doctors is this. They're scared. They're afraid of knowing. And they worry about what next if I find out. And at the same time, they don't trust the doctors. That's a common theme. Studies have shown over and over again that if you see a doctor that looks like you are most likely to follow their recommendations and do what you're supposed to do. However, in the entire United States, there's only about 1.5% of doctors that are black men. Total about 3% of doctors are black in the entire United States. So you can imagine the sheer volume of patient population to this small microcosm. So the fact that you can now find someone that looks like you that you can trust, guess what? You don't want to go. And the few that are out there that you can trust, they're too busy to see you. So by virtue of that, most men say, I'm not going to waste my time to stay 3-4 hours in the doctor's office, so they're not going. So the goal is, how do we make it convenient for men? How do we make you realize that your health is a priority? And those are the things that lead to delays in diagnosis. And those delays in diagnosis are the things that lead to us dying younger, because things that are curable, treatable, are diagnosed at a later stage that makes us die younger.
Gotcha. So I will say, we women are scared too.
Yeah.
We're scared of going to the doctor, but we do it. We're scared of the results, and we're scared of the potential diagnosis that comes with it and how we would treat that.
Exactly.
But we're not so scared that we won't go, because we love and need to be here for
Exactly.
our family, for our men, for our children, for our family and friends. So I'm going to switch over to Dr. Andre Baptiste, who is joining us today in this conversation, so that we will put this focus back on the male discussion. So Dr. Andre Baptiste, please join the table. We're glad that you can.
Hey, Dr. Baptiste, thank you very much for coming, man.
Oh, thank you for having me.
Good to see you, bro.
Good to see you too, man.
See you.
Good to see you, man. All right. So I'm not sure what question we're on today here.
Real life.
Okay, let me get my... So we had our fire talk discussion, and we
Yes.
learned a lot about men's health. Like, what do you think is the current state of men's health right now? In terms of life expectancy for black men, especially.
So like we're just discussing earlier before you came in, it's there's hope for black men's health. However, based on the data that's out there right now, knowing that if you were born in the 1950s, your life expectancy is probably 61, 62 years of age. If you're born in the 1970s, you're about 65. If you're born in the 1980s, you're about 68. If you were born in the 2000, you probably live to be about 69 years old. If you're born in 2010 and forward, probably 71. So you can see that majority of the men watching this today might be in that category of between 1950 to 1970, or less than the 1980s. And if you average those lifespan, it's about 66 years of age.
Right. Now, you did mention how like once you get to 65,
Yes,
that's sort of the key. Getting to
exactly.
65.
Getting to 65 is very important, because what happened is most men will die before that if you don't make it to 65. And that's the people always ask me that, why is that happening? But it's multifactorial, in the sense that if you look at the big scheme of things, a lot of black men, are uneducated or undereducated. If you look at the data, only 25% of black men actually have a college degree and educated. So by lack of education, number one, some have a low socioeconomic status by virtue of the way the system is designed itself,
Right.
and low income, and also they do not trust the healthcare system. So when you look about the socioeconomic factor that affects health itself, those are the reason why we're seeing this.
Do you think ego plays a role in it? Because I feel like sometimes, even in myself, I feel like sometimes something might be a little bit different, and I might feel like, yeah, I got this, kind of,
Like most men.
yeah, like, it's not that I'm scared to go to the doctor for it, but just like, I'm gonna work it out. I'm gonna work it out. I'm gonna figure it out. You think that's like a thing too?
No, that's not it. It's more fear than anything else. Fear of the unknown. See, I think ego might be part of it, because we like to be in control.
Right.
And the idea of losing control scares most men. Like, if they find something, then I'm not in control anymore. So somebody else is in control of my health now.
Right.
In control, driving my health now. So they just not being able to let go and let someone take care of you. It's one of the driving forces that should I say, prevent men from going to doctors or wanting to know.
Right. And you know what percentage of men do you think like make it to 65? Like, is there is it 50-50 that black men that make 65, or is it like 30% make 65?
It's hard to coin that data, because remember, life expectancy data, it's more like I'll put it this way. It was coined by using an estimate
Right.
of people that were born at a specific date or year or decade to determine what your life expectancy are. So there are some things that may be happening during this period that make your life expectancy shorten. So we're going to get to that later when we look at the causes of these decreased life expectancy in black men that we're seeing, and we're going to talk about that extensively.
And the reason I ask is because recently I was looking at something, and someone had made a point to me about foods in 100 years ago and all this stuff, whatever. I specifically looked at 100 years ago what the life expectancy of people, men were in this country, like all men.
Yes.
And 100 years ago, like 1920, it was like 53.
Yes.
It was 53. But there was so much childhood death.
Exactly.
That really weighs into that.
Yeah. So the reason why we're seeing it different now is because of the advances in healthcare, in medicine, technology that they did not have back then. Back then, we don't have immunization. We don't have all this medicine that we take right now. We just use whatever herb that's out there. And so people tend to die young, or they may live a full life, but they die young. But with the advent of improvement in technology, you realize that we have treatment for things that people were dying from back in the days. And that's why we're able to extend the lifespan. And now we actually see more advances that enabling men to live longer, women to live longer. However, a lot of black men are not taking advantage of that, like nutraceuticals and all these supplements that we use, anti-aging and things like that. That's so sexy out there right now for men, because everybody want to live longer, and they're doing all the things to keep them young.
But how do you feel about those things? How do you feel about all the supplements? It's a huge supplement industry. It's unregulated.
Yes,
it's out there. How do you feel about it?
It is scary because it's unregulated. That's why before you venture into the field of supplements, you need to educate yourself. Education is very important, because someone say take this doesn't mean you should take it.
Right.
Take the time to research it yourself. There's information out there. If you seek, you will find. Right. Before you start taking things, because it's scary.
And I think people also are under the misconception that if something's all natural, that you can just take it, right? And like dose doesn't matter, interactions with your medication don't matter because it's natural, right?
That's a misnomer, because natural doesn't mean it's natural, because they'll still have additives into it that actually might affect your health, may interact with the medication you're taking for your diabetes, your blood pressure, your cholesterol, and other ailments that you may have. So that's why they always say to people, before you take something, ask or educate yourself before you take things willy-nilly, because it may interact with what you're taking and might end up causing you harm.
Right. And even though it's natural, it's still a drug, right?
Exactly.
It's still a chemical. It's still something, even if it's all natural and it can interact with your other things.
Exactly.
What is the, like, we talk about men dying before 65. What is the leading cause for Black men in terms of death?
Before we even get to that, it's like when we look at, this shortened life expectancy, several research are beginning to look at why are we seeing this, particularly in Black men. In the big picture, men die younger than women, period. Right. At least if you look at the average for the general population between Black, white, or all races, average lifespan for men in the general population is about 76. For Black men, it's about 66 to 70. Okay. So that's the norm that you see. But when we focus on Black men, then some things started becoming more apparent. And in the field of science, we started using the word allostatic load. And allostatic load basically is the cumulative effect of chronic stress and environment on your mental and physical health. So in healthcare right now, we start talking about the social determinants of health. So this emanates from this body of evidence that's coming out that shows like chronic stress and environment impact your overall well-being, both physical and mental health. And I'll break this down deeper. So when you look at, allostatic load is the amount of stress you carry chronically. When it gets to be too much, it becomes allostatic overload. For Black men, when you look at the stress part of it, you can break it into several things: structural racism, policing and justice, low unemployment, socioeconomic status, homicides. So the more you deal with it, the longer you deal with this, the stress of it itself has a deleterious effect on your overall body. Yeah. So what ends up happening is we've studied the impact of this stress on your life itself. And its studies are showing that the more of these stressors you deal with that put you in a state of allostatic overload leads to early death. Because what happens is this: we have the stress response hormones, cortisol, which is a steroid, endorphins, epinephrine, and a slew of other hormones. So what happens is on a daily basis, we go through stress. However, when you meet the stress challenges, the level of the hormone goes up and it goes right back down.
Right.
But if you stay in a perpetual state of stress, you have persistently elevated level of these hormones. And what happens to you? You start developing chronic conditions like diabetes, hypertension, coronary arterial diseases. So studies are now showing that Black men actually develop chronic health condition 10 years earlier than any other race in the population.
Now, question. Now, is this a uniquely American thing, or is this something that sort of like Black men in other nations would have as well? Like, I'm trying to see, like, is it because of the stress that the United States specifically puts on Black men?
So every part of the world, there is different type of stress.
Right.
And the longer you stay in that state of stress, is going to lead to physical and mental impact of your health. But when you look at the United States as a country, based on the things that we're talking about, like the Jim Crow, the new Jim Crow, the structural racism, and the idea that there's this perception that as a Black man, failure is what's going to happen. Like you're going to fail.
Right.
So there's this stigma that you're going to fail. So Black men tend to have what I call a phenomenon called John Henryism. So there's a Black guy called John Henry in the early 90s, while they were breaking down tunnels and building tunnels.
Mhm.
And basically, they have to use sledgehammer and drill a hole through the mountain so they could put dynamites in it. So John Henry was the strongest guy that does that. So when they brought a new technology, a machine to drill, if the machine succeed, all those men will lose their job. And they're mostly black men. And John Henry said, not in my world, not in my life. We're going to build the machine. So they had a competition between John Henry and the machine, drilling through the rocks. By the time they were done, John Henry was able to drill up to 14 feet into the rock. The machine did 9 feet. While everybody was celebrating, John Henry died with his hammer in his hand. Let that sink for a minute.
That is a powerful.
So the story of a black man that want to make sure that they do not fail at all costs. They want to be around to provide for their family. They want to be the head of that family. And they just keep going,
Right.
neglecting their health. They just keep going. They may be feeling something, but I can't fail. I got to provide. I got to do this. And they neglect their health. By virtue of that, and the stressor of doing what they're doing also has a cumulative effect on the overall physical and mental health. And that is why we developed this chronic condition 10 years earlier than any other race. And you could see this in the diaspora, because every diaspora deal with different kind of stressors.
Right.
You know, brothers in Africa, Caribbean, everybody's dealing with some kind of stressors. Brothers in Haiti right now, they're dealing with their own stressors as well right now.
Right.
So there's stress everywhere you go into the world. It's about how do we manage this effectively? And that is a problem.
So what is the solution? How do we manage this? How do we change this? How do we make it better?
So as it comes to that, the jury is still out, because one, there are things for us in America that are structurally built into the system. So studies actually have shown that depending on where you live, you may actually live longer. I was shocked as I was doing research for this process. They're saying that this is weird, and this is studies that's shown. It's not like a hypothetical stuff. There's a place in Virginia, I forgot the name of the town now, that black men, women live to be 100 years old. They're saying if you're a black man in Montgomery County, Maryland, you're probably going to live longer. The reason why they're saying that is, and this happens to be in most democratic areas. There's an area in Florida, I forgot the name of this town now, that black people in that area actually live longer. And the reason why is they have structures that's been able to erode this structural racism that's put into place. We have increased civil rights participation,
Right.
that start breaking down the barriers. In those areas, those stress are kind of limited a little bit,
Right.
tempered a little bit, mitigated a little bit,
Yep.
and they tend to live longer. And in those areas, they have a community, they have a village where we support each other. But here where we are, everybody's an island. You know, it's me, myself, and I, me and my family, and that's it. But when we have a village to support each other, we take some of those stress away. And that's what we're seeing.
And you know, if you think about it, for most of human history, we've lived as villages.
Exactly.
We've lived as groups with common causes.
Exactly.
So to be isolated like this is relatively new in human development.
Exactly. So it's that's the new norm now, because it's like we always say it takes a village.
Right.
You know, we walk together, we form our own community. And if I'm going out, I say, keep your eyes on my kid for me. If my kid misbehave, you can chastise them for me. But now you can't do that.
No.
So those are the things that's eroded our society. And I do not know how we need to get back to that, because we need to get back to becoming a village again. So I always tell people, anywhere you go to, if you relocate anywhere, you need to find a village. Create your own village around you. Don't wait for somebody else to create it for you. You seek the village and put the village together. Because the more you have the village, you fellowship together and you support each other.
Mm-hmm.
And you will be your own emotional support. And you watch the village thrive. And that's what we need to get back to. We have to get back to that.
I think you're 100% right. When we moved to Florida, we were fortunate enough to find our village. And, I think that our kids have benefited tremendously from it. I've benefited from it because, I feel like I'm in a position where I try to not participate in stress. You know,
Yes.
I try to just leave stress at the door. And, maybe I'm fortunate that I can do that. But, I think having people around you, good people around you that you trust and relate to, definitely helps with that.
Exactly. And going back to the question you asked earlier about the leading cause of death for Black men. So when we look at it, we can strategize it, look at the whole picture of men in America. Heart condition is the leading cause of death, followed by cancer, followed by unintentional injuries, then stroke. So for Black men in particular, if you develop heart condition, or 30% of Black people will likely die from heart condition. And the reason why is this. We'll talk about preventive care. What are the contributing factors to cardiovascular health and cardiovascular death? So if you have high blood pressure, high cholesterol, but you don't know that you do. So I always tell some of the clients I take care of, every man I know, once you cross age 40, I ask you to start screening your blood pressure on a weekly basis. Because 1 in 2 men will develop hypertension after the age of 40. But if you don't know this, you don't know. So if you're screening yourself by just checking every week, once a week, you can see a trend.
Right.
So if you happen to be developing hypertension, you can identify it early, make some lifestyle changes to prevent it from happening. And I'll tell you my story. When I turned 40, I started checking my blood pressure once a week. And it was fine. I check it sporadically once a week. When I turned 50, I started checking it 2 or 3 times a week. It was 2.5 years ago after Thanksgiving. On my routine check, it was higher than normal. I said, that's odd. I thought maybe I had too much salt during Thanksgiving festivities. Right. So I took some salt pills, salt medication and stuff like that to get the salt out of my system. Pressure went back down. I said, oh, maybe that was it. But as soon as I stopped the medication, it crept back up. I was like, oh, I have hypertension. And I looked at myself, I eat healthy, I work out.
Right.
So I do all the right things. The mind is genetics. So there's genetic part to hypertension or cardiovascular disease, and there's the non-genetic part of it that is controllable. So in my situation, there's nothing I can do about it.
Right.
Because I eat right, I exercise, I do all the right stuff. But the problem there is this. If I had been checking myself, screening myself on a weekly basis, I would not know I have high blood pressure. Every time I worked in the hospital this week, I can tell you I diagnosed about 5-6 men with hypertension. They didn't even know because they came to the ER with something unrelated. They said, why is your pressure this high? You have it? No, I don't have it. When was the last time you checked your pressure? I never checked it. You got high blood pressure. Because it sneaks up on you. We call it the silent killer. And the reason why it's a silent killer is like, you can have a heart attack if your pressure gets too high. You can have a stroke. So that's why for Black people, Black men, cardiovascular disease and stroke kills us because blood pressure that's not controlled. If you have high cholesterol, you don't know. If you don't go see the doctor to get screened to see what your cholesterol is, you can mitigate against it. So those are the contributing factor to cardiovascular health that's killing us. Then when we look at the cancers, though, that's the one that's sad and that concerns me a lot. When you look at the top 3 cancers that kill Black men, we have prostate, colorectal, and lungs. So for prostate cancer, this pains me because it's curable.
Yes.
There's no reason for Black men in this age to die from prostate cancer. And this, I'm passionate about this because if it's identified early, it is curable.
Yes.
However, so if you look at the data, most of the prostate cancer that's diagnosed in Black men are later stage prostate cancer.
Right.
That has a prognosis of about 5%. Or 90, chance of dying between 60 to 70%. If you have an early stage prostate cancer, chance of you dying from that is less than 5% because it's curable.
Right.
So we need to switch the paradigm to be identified earlier because one of us will develop prostate cancer. But if it's identified earlier, it could be treatable. Right. So there's no reason for us to be dying, almost 40% of us dying from prostate cancer because it's diagnosed later than normal. So if you have a chance of survival in 5 years at a later stage prostate cancer, it's less than 95%. So that means you're going to die
Yeah.
within 5 years.
And the thing is, and I think a lot of people also, the men are scared of the test for it
Yeah,
because they don't realize that you can just do like the PSAs and all
exactly.
that stuff. You don't have to get the finger, right?
You don't have to get the finger every year.
Okay. Right.
Maybe every 2-3 years you can get a finger. But there are better ways to even do that now, you know. So for me, most of the men I care for, every year we just train the PSA, which they have better studies right now that are highly accurate, and we can trend your PSA. If we see that from year to year is going higher, and it's expected to go higher as you get older, as your prostate enlarges, your number goes up. However, if we see a dramatic rise above the normal, and that is a red flag, like, okay, something is not right here, then let's start doing screening to see if there's something going on there. Let's go do more invasive study to identify if you have something.
Then you get
there.
the finger.
Exactly. You get the finger, you may get a biopsy, and there's some other scan that we're using right now to help you identify if there's any abnormality in your prostate.
Okay.
So that is why it's important to get a preventive screening. I do yearly PSA on my clients to make sure that we have a map to trend it. And if I see that, okay, you less than 4, we okay. But if I see you go from less than 4 to 10, we got a problem. Even to 6, we have a problem. Something is going on.
Right.
And the second cancer that's killing us is colorectal cancer. Actually, it's sad because we see an increase in amount of colorectal cancer in Black men, and mostly young Black men. Of all the colorectal cancer that's diagnosed in the US in the past few years, 12% of them are diagnosed in Black men under the age of 50. Let that sink for a minute. And 40% of those men are likely to die from that colorectal cancer. Because by the time it's diagnosed, it's like stage 3, stage 4.
Yeah. That's about 4 times more than you would expect.
Exactly. Why? The same thing we are afraid to know. So if you're a Black man, and let's say these are the signs and symptoms you look for potential colorectal cancer, and you know those signs, such as, okay, there's a change in my bowel movement. I'm having pain in my lower abdomen that is abnormal, that it's unusual for me. Or I'm seeing blood in my stool once in a while, you know, and I don't have hemorrhoids, but I'm seeing blood in my stool. Those are red flags to say, maybe I need to go get checked. But most men don't want to get checked. They don't want to. Now they're afraid now that I may have cancer. I don't want to know. And by the time someone actually compelled them to go see a doctor, it's too late. You know, I've seen, you know, cases like that. I've seen the young men with stage 4 colorectal cancer that died from it within 2 years. And it pains me when I say that Black men should not die from preventative condition in this era. We should not. You know, other than unintended injury like accidents, violence, and stuff like that, but we should not be dying from health conditions that are preventable or curable. So that is why it's imperative for us as Black men to take ownership of our health. So we need to be around to be fathers to our sons and our daughters, to be husbands to our wives, partners, and to be contributing members in our community and doing things in our communities and be mentors, brothers, then going to funerals while we're young. So that is concerning. The fact that 12% of colorectal cancer diagnosed is on Black men less than age 50. And if you look at the screening that's out there, if you say you want to have a colonoscopy, they say, oh, after the age of 50.
Yeah.
So I refute that. And I tell most of my clients, once you cross 40, I want to screen you. I want to get endoscopy, colonoscopy on you so we have a baseline. And we do it every 5 years after that.
Right.
But insurance company will not pay for it because you're not 50 years old yet. So most of my clients pay out of pocket for it. Unless you have a strong family history, and even that you have to fight with a nail for it to be approved to get done. So so when you talk about access, lack of insurance, number one, a lot of Black men do not have health insurance. And by virtue of that, that's a barrier to entry into the healthcare system.
Definitely.
Because you're like, how am I going to afford it? Who's going to pay for it? I don't have insurance. So you're suffering through this condition because you didn't have insurance.
Right.
And I'll tell you, there's someone I saw a long time ago, a few years back, and they had a cancer, and they're afraid. They didn't have health insurance, and this cancer is getting worse. It's festering. They show up at work one day, and the job was smelling funny. And they're like, "What is smelling? What's smelling here?" Because the cancer is first naturally smelling. But this person is not immune to the smell. They just pour perfume on it.
Right.
But it's creating this odor at the job. And everybody was like, what's smelling? And the director came out, like, what's going on? And they track it to one person, like, hey, what is that smell? And they got them into the office. What's going on? And they started crying like I have something. They sent them to the hospital. But it was stage 4. There's no cure because they don't have health insurance.
Right.
So thank God we have a sponsor, Florida Blue, that's been able to provide customized, curated, affordable healthcare for men. So it's about education. So if you don't know what resources you have out there in terms of how do I secure health insurance that's affordable, you'll never know. That's why it's important for us to seek information.
Yep.
But how do I get insurance? Oh, it's too expensive. No, there are affordable health insurance out there. I have a lot of brothers that actually carry Florida Blue insurance because they say they can get a low-cost insurance for their life because they want to take ownership of their life. So health insurance is a barrier to entry into the healthcare system. And about 75% of black men do not have health insurance, which is huge. So when you look at the big structure as to why we die young, it's because of this.
Now, I don't know if you know this number or not, but like, is it like different in countries like Canada where they do have health insurance? Like, is there a difference in the rate at which, you think black men are getting
it's
cancer?
hard to look at the black in Canada, or you just know it's like of all developed countries,
Right.
the life expectancy is better in every country other than the US, and we spend the most in healthcare.
Yeah. That's
So we spend almost 3 times more than the next country in healthcare resources, expenditure.
and have terrible outcomes.
And we like probably close to the bottom in outcomes, which is sad.
Let me ask you a question. I recently was exposed to the body scans. Like they say they can do like a colorectal scan, where they can do the entire whole colon with a scan. They blow it up and they can do it. How do you feel about doing those scans as opposed to a colonoscopy?
So colonoscopy, so the scan look at your bowel, but they can see the outside but not the inside. So that's where colonoscopy comes in. If you have a tumor that's eroding the wall of your bowel, you will see that on the scan. But if you have a small tumor that's just growing inside your colon, the scan may not see that. That's why the colonoscopy comes in, because it looks in there, look at the wall of your bowel all the way to see if there's any abnormalities in there. So that's the difference. So they use a scan for screening, but it's not as effective as seeing the inside. If you have something that's huge, the scan will see it.
Right.
But if it's just developing, it's just in the polyps in your colon that the biopsy, oh, it's cancerous. Versus waiting till it erodes and you see that on the CAT scan.
Okay. That makes a lot of
So
sense.
colonoscopy is the way to go. And now they're making it easier. They have, I'm not promoting anything here. They have a color guard now where you take the pill and you just take pictures and, and poop it out there, but it records as it goes down so there's an easier way to do it. And there are more technologies coming out now that you can actually just take the camera and you swallow it and it just goes down and it takes pictures.
That is really
so less invasive. But the most important thing is to be able to see the walls, make sure things are identified earlier and taken care of in a timely manner.
Well, I'll tell you what, I even just talking to you now, and most of this stuff, I know a lot of the stuff, but hearing you say it right now makes me want to change a few things in my life right now.
Which is the purpose of this summit.
So I'm sure the people watching this definitely are getting a ton out of this, because I'm feeling like I got to take my blood pressure more often.
Yes.
I've never had hypertension, but you never know.
You never know.
Like you said, silent killer.
Exactly. It's a silent killer. It's like, I'll tell you a story, by being in the front line for more than 2 decades now, I've had different stories to tell. I remember somebody that they have high blood pressure. You say you got to take care of your blood pressure. You have to take care of your blood pressure, but they're not compliant. And it's one thing to have prescription. It's one thing to follow the prescription recommendations. We don't take it as we're supposed to. So what happens is you have high blood pressure, you have prescription, and sometimes when it gets to a certain point, it's not working anymore. So just because you're taking prescription, you're not checking your blood pressure anymore because I'm on medication. So I always tell people that despite the fact that you're taking the medication, you should still check your pressure at least twice a week to see if it's working.
Right.
Because it gets to a point where it's not working anymore, where they have to increase your dose. So I've seen people show up with like stroke-like symptoms, or they're having a stroke. A pressure is off the chain, off the charts. And you ask them, are you taking your medication? Oh, I'm taking it. When was the last time you checked your pressure? I don't check. I'm on the medication. And they just had a stroke because the medicine is not working anymore.
Right.
So just because you're taking medication does not mean you don't have to check your blood pressure. You still have to check it. And as we round up this session, the question is, how do we change this paradigm?
Yes. How do we do it?
How do we change this paradigm? One thing we have to do is this: pay attention to our cardiovascular health. What are the risk factors for cardiovascular disease? Hypertension, diabetes, high cholesterol, obesity. So just understanding those are the risk factors. Ask yourself, what can I do to mitigate those risk factors? Which of them can I control and which of them I cannot control? So I need to start screening myself for blood pressure. I need to know my baseline cholesterol. I need to make sure I don't have diabetes. And if I'm obese, since I know it's a risk factor for cardiovascular disease, what do I need to do to change that paradigm? So if we do all those four consistently, we can minimize the effect of us dying from cardiovascular disease. Now, we talk about stress. I said stress is the enemy that we hide, because especially Black men, we don't like to talk about it. Our ego, supersedes on that, because talking about stress makes you feel less. That's the perception. Like, I'm not macho anymore. I'm weak now.
Yeah.
I'm a whiny, weak man. Well, that's not the truth. We have to know how to address stress. There are several resources out there, tools out there that help you effectively have a balance in how you manage stress. The goal is to be able to deal with stress in a way in confine of functional stress. Functional stress is the stress we need to thrive. Once you address those stressors, your level of your stress response hormones goes back to normal. You need it for the stress, but it goes back down to normal. We need to get to that phase of addressing stress like this versus staying in a perpetual state of stress.
Yes.
So we need to find tools that will help us navigate that waters. And one of the things that actually affect Black men a lot is sleep. Sleep. I always say, sleep your way alive. And people say, oh, I'll sleep when I die. But what happens is sleep has a significant impact on both your psychosocial, physical, and mental health. Because if you're not sleeping well, you become emotionally labile. Because most of the time, if I don't sleep well, I'm short. You're snapping at people. You're very impatient. It's hard to formulate a constructive interpersonal relationship with other people. You're less productive and you're prone to accident because you're not sleeping. And most studies say to sleep at least 8 hours. Not everybody can do 8 hours a night because of just the dynamics of life. But you need to find a sweet spot. And my sweet spot is 7 hours. But to even get that 7 hours, you have to be intentional. And the reason why this is important is this. While you were sleeping is when your brain actually works the hardest. For all the things that you've gone through throughout the day, while you were sleeping, there are chemical reactions that your brain went through throughout the day that has a byproduct, waste. So while you're sleeping, the brain does its own tune-up and clears those wastes from your brain to make sure that we store memories in different compartments, to make sure that when you wake up in the morning, you're fully alive, you charge, you're ready to meet the challenges of the day because you're fully rested. Have you noticed that the days you don't sleep well at night, when you wake up in the morning, you're foggy and kind of a little bit groggy?
Well, I'm a little bit different, but I'll tell you what, because I always say sleep when you're dead. Sleep when you're dead, right? I say it all the time. But I'll tell you what, when you explained it to me the other night, what it felt like to me was like throughout the day, everything that goes on, your brain just shoving it in. It's like a big old messy room.
Yes.
And then at night, someone comes around in your brain and takes all that stuff and puts it, well, this belongs here, this belongs here, this belongs here, and then it's all organized for the next day.
Exactly.
And since you mentioned that, I've tried to purposefully get more sleep.
Amen.
Although when I don't get sleep, it doesn't really change anything for me.
Okay.
But I think it changes things on the inside, things that I'm not aware of.
Exactly.
And that's why I think.
And I'll tell you why that is important. It's because now that studies are showing that if you sleep in less than 6 or 5 hours a night, you may develop Alzheimer's dementia earlier. And the reason why is this: all those deposits, the sludge that the brain clears out, that you're not allowing to clear because you're not sleeping, because you're not giving the brain enough time to do its tune-up. All those sludges deposits in the brain. So when they're doing MRI and scan of patients with Alzheimer's dementia, they're seeing these bodies deposited on the brain. And they've looked at scan of people that sleep well and did not sleep well, and they've seen the changes. So that's why it's now we have to talk more about this, because sleep is very important, because it does not help anybody for you to grow up to be 65 years old and your Alzheimer's dementia, you can't function.
Yeah.
So you might as well get the sleep now so you can function effectively. So sleep is very important for us to stay alive. It's very important for us to stay, should I say, to build to build strong relationship with our spouse, with our neighbors, with the village, for us to be more productive, for us to be less prone to accidents and injuries. Sleep is very important. And knowing all that and prioritizing our health, doing the preventive care that is needed in a timely manner, remove the stigma that I don't want to know, make it want to know, because I want to be proactive. I'm tired of men playing defense when it comes to their health. We need to be playing offense with our health. We have to be proactive with our health. If we do all this, we will change our paradigm from decreasing our life expectancy to increasing our life expectancy. And, like I said earlier, we have a sponsor, Florida Blue. We know that access to health care also has to do with lack of insurance. 75% of Black men do not have health insurance. Do your research. There's information out there how you can get a low-cost health insurance that will provide you access to be able to take care of your own health. If you don't have insurance, there are also several facilities in the community that have free health centers that you can go to and get screened. So seek help, seek information, and you will find it.
Well, thank you very much, Dr. Adewale.
Oh, thank you.
Go ahead.
And we need to talk about our next episode, which is next Saturday.
Yes.
And I'll let you talk about that.
Okay. All right. So, thank you very much, Dr. Adewale, for creating this fully alive men's health summit. I'm going to take away a couple things from this. I'm going to take away the sleep thing. I got to sleep more, definitely. I'm going to check my blood pressure now, and I'm going to talk to my doctor about getting a colonoscopy. I think it's about 5 years anyway. So I am definitely going to benefit from this. So thank you very much, Doc. And I want you guys to tune in. Next week, we are going to be having a live premiere of Fire Talk TV, and the episode is about men's health. So we're going to be discussing men's health. Dr. Adewale is our guest on that episode, and it's a really exciting episode. It's very informative. I learned a lot on it, just like I learned today. So hopefully we'll see you guys there. But I'm really looking forward to it. It's going to be a big event.
And following the live fireside chart, then the following week we're going to have cooking demonstration with Ebony, a nutritional consultant. Basically, it's an interactive, how do you eat healthy to prevent diseases? And we're going to have a lifestyle demonstration. And the goal is to invite your spouse, your partner to be a part of it. If you've not registered, go ahead and register. So if you register, we actually try to provide you the recipe in advance so you can get your own recipes, so that when we're in the studio cooking, you can cook with us with your spouse in the comfort of your own kitchen. And the following week, we'll be having functional mobility for men. Basically, a lot of men try to be active. They're not active. They're not consistent. They get injured while they're working out. So we're going to provide you tools from MS Fitness on how to work out with ease to promote your longevity. So join us then. And at the end of the month, we're going to have the full celebration, which is a brunch for men's health. We're looking forward to seeing you then. And that's a live event. So please register. And we're looking forward for you to partner with us so we can provide you information for you to be fully alive as a man watching this. So thank you for watching this episode. Until next time, you stay healthy.
All right. See you guys.
Woof. A way of life.
That
was awesome. That was awesome.
Sorry, I'm late, man. I had no idea.